All right, I'd like to just introduce Dr. Adam Barnard. Earned his bachelor degree in communications with emphasis in mass media from California State University in Sacramento, thinking his life would take a route to corporate marketing and advertising. He would eventually earn his doctorate in physical therapy from California State University, Fresno, being selected as his class president. His doctoral thesis covered the effects of the whole body vibration on patients with knee osteoarthritis and following total knee, I guess that's surgery.
Yes, knee replacement.
Yeah.
Yeah.
He was a personal trainer and business manager for several years, always desiring more scientific approach than a personal training afforded. And his approach to physical therapy, Adam honed his service skills in hospitality industry working as a bartender. No, you're not getting booze tonight. He worked as hospitality lobbyist and liaison and even in corporate operations as a coach for 50 quick service restaurants in California. He is now Gene's personal therapist. I'd like to introduce Adam Barnard.
Great, thanks so much. Thank you, Norm. Thank you so much. Hello, everyone. Hello. Thanks so much for having me. I'm Adam Barnard. I'm a physical therapist. I'm also our clinic director at our Prunedale location for balanced physical therapy. I'm here today to tell you a little bit about what physical therapists do. I'd like to see who here has had physical therapy, if you mind sharing. Okay. Good outcome, not so good outcome, how'd it go? It went good? Okay. Yeah, sometimes I feel like we're labeled as the personal trainers, massage therapists of the medical world. And although we may do those things, that's not really everything about what we do. So luckily, you're able to spend more time with someone like me than you would anyone else in the medical industry. I think the average is 8 minutes you can spend with your nurse, and I think it's 2.5 minutes, somewhere around there, where you spend with your physician. So everyone here has had those really quick, short meetings, right? And you probably left wanting some more. So if you come see someone like me, because of the level that we're educated at, we can recognize other things that you may need a referral out for, or we might just say, hey, you don't got to worry about that. You don't got to get an MRI or anything like that. Just come on, just keep staying with me. So to begin, I want to thank everyone here. Thank you for taking time out of your weekend and coming to see me on this lovely day. You have a lovely church. I've actually never been here, so I was really happy to see the invitation come from Gene. I wanted to give a special thanks to the Hoffmans, Gene in particular. You've been an absolute joy to work with over this last year. Yeah. And it really is just incredibly enjoyable to see you. I know I help Jean out with her body, of course, and anything that's going on, but she actually helps me with her maternal advice that she gives me. So thank you so much, Jean. So thank you for this opportunity. I wanted to begin today, folks, by telling you what is a physical therapist. There seems to be a lot of miscommunication about what we do, and people sometimes don't really know what we do in the PT clinic. I really love it when somebody stops by in the community out in our Prunedale location, and they're just poking their heads in. They want to see what's going on, in there. So I love bringing them in. I'll be working with the patient, but I'll kind of step aside for a second and I'll walk you through the clinic and just show you that it's not weird, it's not scary. Sometimes people are kind of nervous about what goes on behind closed doors, but it's all very professional, very clinical, and usually folks will leave feeling better than they came in. So physical therapist, we have a doctorate education now. I believe as of 2013, all physical therapy programs in the nation are at that doctorate level. We are the neuromusculoskeletal experts, as we're known. I like to tell people that if you go see your medical doctor and they can prescribe you medications, but if you come to see me, I prescribe exercises. So there may be a little bit of that today too. I know you. If you saw my name on the docket, you might have thought, oh, what's he going to make me do? Well, maybe. We'll come back to that. We're highly specialized and trained in how the neuromuscular system works, how it works in conjunction with your skeletal system. Usually people come to see us for their aches and pains or post-operative, so following a surgery. And what we can do for you is show you what not to do in order to decrease pain. And we can also show you how to shorten the amount of time that you take to heal. So the body's going to heal whether or not, but if you have someone like me, I can tell you what to avoid to try not to make things worse, and then also how to move specifically so that you don't get into that problem once again. We're highly trained in anatomy, in physiology, and kinesiology. The classes, just for example, leading up to a physical therapy program are strong with physics, chemistry, biology, anatomy. Interestingly enough, in physical therapy school over the first year, we're actually dissecting a cadaver. So not everyone knows that. I like to share that. Yeah. Interesting story on that. When I was touring Fresno State and deciding what physical therapy school I wanted to attend, they said, okay, here's our anatomy lab. And so I said, okay, and I just kind of trot over. And then immediately I saw the cadavers, and I had never seen a cadaver before that. They didn't give me any warning like that. So it's not for the squeamish, but you do get used to it pretty quickly, and it allows me to have a much clearer understanding of what's going on beneath the skin down in there, because everybody's different, right? Like I said, we commonly spend the most time with our patients at Balance PT. We have 40-minute long sessions, so you can probably plan on about an hour out of your day that you'll be spending with a therapist like myself. Just on that note too, we have locations in Monterey, Salinas, and Prunedale, and in about 2 weeks we're going to be opening our 4th clinic in Ryan Ranch to better serve the community. Yeah, and it's 143 John Street where we have our largest clinic here in Salinas, so real close here. You may be thinking, well, okay, Adam, so why should I care? Why are you up there? So we all want to live longer, healthier lives, right? You want to maximize the time that you have while here on this earth to move around and to interact with your family and friends and to be able to come to settings like this, right? And so you want to be able to see somebody like me so I can tell you, hey, that's not so bad, or hey, maybe you should go get that checked out, or maybe you should even consider surgery on there. I was speaking with a gentleman back there, Moses. Thank you for sharing that with me. He's having a little bit of arm pain, and I told him, what I thought of it without a full-on examination. But that would be a really common thing that I see every single day. I've got a little bit of arm pain right here, or maybe on the side, maybe a little in the neck and the back. That's what I deal with all day long. So if you've got any of that, you come and see somebody like me. Who here has a pain like that? Anybody? Okay. And that's totally understandable, okay? Everybody has their own thing, so we make sure we take the education and then we take a look at you to see what we can do for you. There are many myths concerning exercise and the use of your body. Now with access to the internet, there's just a whole slew of stuff that you can choose from, and you may not know what to do. So really commonly someone will come to me and say, hey Adam, what do you think about this exercise program? Or what do you think about moving like this? Or what do you, I do this all the time and I always feel this. Why is that? So someone like me can tell you, tell you exactly what's going on in there. Slowing the aging process is easy. Would you agree? No, I don't know. I know you may not believe it, but it is true. If you start coming in and seeing somebody like me maybe twice per week and then doing your own home exercise, I think you'll be very surprised what your body is capable of, no matter how old you are, okay? No matter what you're dealing with. Let's see, so having the right tools is essential. So you want to make sure, a lot of times we see it around here with the New Year's resolution. How many people know someone who made a resolution to start working out? Yeah. No, Norm said, like I worked at a gym, yeah, it's right around March, it kind of starts dying off, yeah. Yeah. So starting is actually easier than the consistency. So I always tell someone that day 2 is actually more difficult than day 1 because you get all ramped up and you say, okay, today's the day I'm gonna go, and then you go to the gym and then you get sore and you say, nah, I don't think I wanna do that again. So that's to be expected, right? You can have like the soreness. So if anybody's starting on your own fitness journey, I would just tell you the discomfort is to be expected, right? But that's a good thing. you didn't go to school and not do anything and become smarter. You had to have your brain adapt to those stresses placed upon it, right? So make sure that you stay consistent if you start, guys. I'll talk to you in June. So baby boomers are the fastest growing age group in the USA. Currently 14.5% of the nation's population is over age 65. And by the year 2029, the national population of those over 65 will be at least 20%. And from what I see, it looks, in my clinic, it looks like it's even going to be more than that. So as we age, our muscle strength and our lung function can naturally begin to decrease. So by moving around in certain ways and doing a little bit of just light exercise, that's going to keep your skeletal muscle and your cardiorespiratory system strong so that you can go flying. Somebody's talked to me about, what'd you say, jumping jacks? Tap dance. So you keep tap dancing no matter how old you are. So these are not people that I know, but I always like to show these pictures, presentations like this, to show you what you can achieve no matter how old that you are. That one kind of looks like Norm. So our muscle strength declines. You may have already noticed that, oh, my muscles are not kind of where they used to be. You know, they might be a little more loose in there. So we have to do a little bit of resistance training in order to strengthen the muscle. And you can see the stats on there. Basically your muscle, the decrease in your muscle strength and size actually increases in its rate as you age. So that would beg the question, like, how can I get started? So you want to get started sooner rather than later. 45% of women over age 65 and 65% over 75 years can't lift 10 pounds off the ground. Now, you may be thinking like a dumbbell or a kettlebell, 10 pounds kind of thing. I like to think about a bag of groceries or even like a suitcase. You need to be able to do that in order to live your fullest life, right? So sarcopenia, you may have heard that word. It's a fancy medical term for just a loss of muscle mass. Interestingly, as we age, if we are not using those muscles enough, they'll actually become infiltrated with body fat. So instead of having that contractile, nice, pretty red contractile muscle, you might have it filled in with body fat, and then, of course, it doesn't take a doctor to tell you it can't contract. Yeah, and so we don't want to have that too frequently. So as a country, we're out of gas. So how do we combat that? One of the most common things that I hear from people is, not most common, but it's pretty common. I'm so tired. I'm too tired to do it. I can't do it. I got too much going on, right? And I would let them know your body is producing that amount of energy because it knows that's all it needs. So if you actually do a little bit of exercise, you'll have more energy on store. It's kind of counterintuitive, right? I have to use energy in order to have more energy on board, but it's totally true. When I am not exercising, I feel more tired throughout the day. And of course, there's the aesthetic purpose too, but really it's for my energy and my mood that I like to move around and exercise myself. It's something I enjoy. So I would say, of course, the exercise is probably not too enjoyable while you're doing it. It hurts, it's uncomfortable, right? But I do it for how I feel afterwards. It's so that I feel calmed down. It's so that I feel happy. It's so that it makes me want to call my mom and my grandma. I have that energy in there. So 25% of Americans over age 18 report no leisure time activity. So do you guys have enough time to do all the fun things that you want, hopefully? And then only 22% of US adults report the sustained activity for 30 minutes 5 times per week. And then almost 20% of all the deaths in America can be correlated with lack of exercise. So think about that. So it's actually really tied in with your morbidity and mortality rate. So what will PT do for me? What can somebody like me do for you? I like to tell people that I'm the teacher and the patient is the student and the test is life. And so you can't, I can't do your homework for you, meaning the exercise, and I can't take the test for you, but I can help you help yourself live the best life possible. PT can do all these things right here. It can increase your life expectancy. It can decrease rates of morbidity and mortality. A big one is decreasing a fall risk. Anybody here know someone who has a fall, has had a fall themselves? Yeah, you don't have to raise your hand or anything. Yeah. You know, and on that note, on the falls, what I want to tell everyone is, don't think that that's normal. Like, you know, pain's not normal and falling's not normal. Sometimes, you know, somebody, you know, not with us, but they might think that, oh yeah, I do that all the time. And it's like, no, I don't want you to do that though, you know. As we get older, if our bones have a little bit decreased bone density, if you break a hip, that's not a good one. That's a big time rehab, and that's really common. So you can also experience increased strength, flexibility, muscle tone. Your posture is good. How's everyone's posture? Everyone just sat up a little taller right there. Right? I love that. I love that the PTs have that effect on people. Everyone kind of stands up a little more tall. And of course, increased mental health status. If you're having a tough time, I know pandemic's been rough on a lot of us. If you're getting out and you're moving around, I can almost guarantee that you will feel better mentally. So this is Joey. He's actually the clinic director of our Monterey clinic. It's over on Fremont. He looks like he's doing just a joint mobilization or maybe an assessment on the thoracic spine. That's your mid-back right there. What can you expect at your physical therapy evaluation? We'll take a detailed patient history after doing so, and then I kind of got my wheel spinning on what's going on with you. I'll take a look I'll observe your body and how you move it, and then that's called active range of motion. Then we'll generally go into passive range of motion, which means I'll ask you to, you know, say turn the arm off, you know, just give me the whole arm or something like that. And I'll move the joint around and see what I feel and what I see. After that, if it's indicated, I'll perform any manual interventions, meaning the work with my hand. It could include some soft tissue mobilization, like therapeutic massage. It could be manual stretching, or it could be a joint mobilization where I'm actually moving like your glenohumeral joint, or maybe like like one of the vertebrae of your back. We will also usually give you a home exercise program, which is therapeutic exercise. I like the quote, there's an old saying that says, if exercise was a pill, it'd be the most prescribed medication in the whole world. Right? And so that's what we will provide to you. So I'm going to talk about some systems contributing to human movement, but this is what you were waiting for, the movement of yourself, right? So posturally, I'd say about half my day is helping people out with low back pain, and another good percentage of it is neck and shoulder pain. So if you are willing and able, I'd like you all to participate right now. Why doesn't everybody do a couple cervical retractions? So sit up nice and tall, and I want you to pull your head backwards, just like this. You don't want to look up. You want to act like your jaw is on a shelf like this, and pull it on back. So you're making a double chin. Who sees a double chin? But you're pulling it back and relax. You're pulling it back and you relax. If you did maybe 10 to 15 of those each day, that's going to strengthen the muscles in the front and stretch the muscles in the back a little bit. It'll keep your head pulled back a little bit better. The next one would be a scapular retraction. So with your hands on your thighs or just on the table just like this, I'd like everybody to pull their shoulder blades back. Yep, there it is. Nobody has to push through pain or anything like that. You're just trying to, it's like you're trying to crack a walnut in between your shoulder blades. So just like that. So try not to let your hands slide and get it just from the shoulder blades. Make sure the head doesn't come out. In the biz, we call it no chickens and no turtles. So you would also do that about 10 to 15 times each day. Last one, just to kind of loosen up the back, go ahead and cross your arms just like this, thoracic rotation. Just go ahead and rotate side to side, go about 5 times each way. Do it nice and tall, open up. You probably hear the snap, crackle, pop. Yep. So that's great. So that would be just a quick little postural reset that you can do at your desk or at your home. Get you sitting up a little bit taller, okay? I'd like now to talk about some systems contributing to human movement. If you didn't know, I don't know if it's ever entered any of your heads, but have you ever thought, how am I moving through space? How does my body navigate that? How do I know where my nose is with my eyes closed? Oh, I missed my nose right there. How do I know where my foot is in space without looking at it? And I'm going to talk about each of these systems to you right now. So the 3 systems that contribute to human movement are the visual, the vestibular, and the somatosensory systems. So what I like to tell my patients, it's your eyes, your ears, and your feet. So the visual system is actually the most used system in the entire body, but it can be affected by myriad pathology, which would then require us to use our vestibular and our sensory systems more to move through space. You got to know where you are and what you're doing, right? Has anyone here had vertigo or dizziness in there? Yeah, and it's not fun, I'm really sorry. So physical therapists are actually the non-pharmacological way to treat vertigo. Through a series of movements, I can determine which of your semicircular canals, that's this little guy down here on the bottom, which of those are affected, and then through another movement, we'll try to reset what has gone wrong in there. And I'll talk a little bit more about that in just a second. So you can see the sensory system, sensitive to touch, proprioception, and vibration and pain. Your vestibular system is activated when your head's moving. It's how your head knows when it's tilted like that, even if your eyes are closed. And then your visual system, interestingly enough, human posture and anatomy, a lot of our upright posture is because we need to keep our eyes on the horizon. So cell phones, tablets, they are not good for us because we're like this instead of like that, right? Anyone heard of text neck? You heard that? It's still text neck, yeah, because you're texting all the time and then your neck hurts. Yeah, don't get that. So first I'll start with vision. It's our most heavily relied upon sense. It provides constant feedback. It gives reference to the environment and obstacles. And you know, if a baseball or something's flying at your head, you know to close your eyes and move your head, right? That allows for an anticipatory response. So that signal, that information, is actually coordinated with some other sensory input in your cerebellum. So that big, we call it the cat brain in the back of your head right there, to help you, anticipate things and navigate through space. The somatosensory or the sensory system is all over your body. We have mechanoreceptors that are sensitive to light touch, deep touch, pain, vibration. They can be affected by things like having a brain injury or a spinal cord injury, something like a stroke, or more commonly diabetic neuropathy. So you may know somebody who has diabetic neuropathy. You have some decreased sensation. Usually it's in your feet in there. Diabetes, interestingly enough, on that last slide, can affect your retina. So you can have diabetic retinopathy in there as well. It gives us information about what we're doing in space. So I know my foot is tilted over just like this without looking at it because of how much muscle is contracting on one side, how much stretch I feel on another, and that information is sent up to my brain. So that's kind of like how we know what our fingers and hands are doing without looking at them. Now lastly, the vestibular system. So this is a really interesting one. Has anyone heard of the vestibular system? Have you heard of that? Okay. Did you ever think like, what is that, right? I'll tell you, I'll explain it to you how I explain it to my patients. So in your inner ear, so on the other side of your eardrum, your tympanic membrane, you have what are called semicircular canals. They are they look like hula hoops. They're 3 rings. The whole structure is about the size of a dime, and you have 1 on each side. So I have 3 semicircular canals, 3 hula hoops on this side, 3 hula hoops on this side. Now they all meet at one area. Now inside of those semicircular canals, I think they're about 1 millimeter or 2 in diameter, so very tiny. You have what's called endolymph. So it's like it's a bodily fluid that allows movement in there. So think if you took a hula hoop that had water in it and you twisted it like that, the water would kind of stay in the same place, right? So based on the changes in pressure of the endolymph within the semicircular canals, your body can tell what my head's doing. So that brings us to vertigo. So vertigo is when at that area where all 3 of those semicircular canals, those hula hoops meet, you have, it looks like a jelly loaf, and they have what are called otoconia, or more commonly known as ear rocks. They're calcium bicarbonate crystals, and through aging or maybe like a head trauma, getting hit in the head or something like that, those rocks can become dislodged and thereby go into the hula hoop. So they're floating around in the water and they're not supposed to be floating around in the water. Now that causes pressure changes in that water, which are then read by the brain. And if we have pressure changes that aren't supposed to be happening, meaning my body thinks my head's turned and my head is not turned, that can result in vertigo. So you have the dizziness, you might have the nystagmus where the eyes are beating back and forth like that. So someone like me can actually determine which of those semicircular canals are affected and then take your head and body through a movement that hopefully reseats those otoconia, those ear rocks, back into place. It's very interesting. It's kind of voodoo if you ask me. It's kind of like physics and chemistry and liquids, and it's really cool. So I'd love to tell you more about it if you like. So some common ailments. I know we've all probably dealt with something like this, right? So has anyone dealt with neck pain here? It's like, yes. How about shoulder pain? Yeah. How about back pain? Yeah. Okay, and then how about anything in the hips? That might be a little bit less common. Yeah, I'm really sorry to hear that, folks. So, I know. So come and see somebody like us. You know, you may be thinking, well, what is that? Why does that happen? It's never hurt like that before. It always got better before. It's not getting better this time. So somebody like me can take a look through that and say, oh, you know, Norm, that's big and bad. You got to get off to the doctor. Or, oh, Moses, actually, you know, you may want to consider like speaking to your surgeon, you know, orthopedic surgeon, see if you want to get that back. And we can tell you if it's something that you need to refer out, or I'm like, nope, don't even worry about that. I can take care of that, and this is your prognosis. It's usually fair, good, or excellent, and I could tell you the amount of time that you can expect for those tissues to heal, either hard or soft tissues. So something like in the neck that we deal with a lot can be what's called a wry neck. You sleep on your neck wrong, right? I think this is a good time to point out the difference between physical therapy and chiropractic. So we are, differing schools train different students in the joint mobilizations. You can have they're graded on a grade of 1 through 5. A grade 5 joint mobilization would be a thrust. So that would be like when you pop something right there, right? I won't do that too often. So although I am trained in that, I use them very infrequently. Most of the time, I would say 95% of the time all day long, I will do a grade 1 through 4 mobilization, meaning I'm moving a joint just a little bit to try to bring some pain down or to increase mobility. Now in physical therapy, we're always thinking about what does the end look like for you? What does discharge look like for you? And it's not because I'm not happy that it's not because I'm not happy to see you in our clinic, but really I want to run into you in the grocery store or out on the golf course or you know, out by the ocean or something like that. I don't want you in the physical therapy clinic because that means you're dealing with something, right? I want to get you better and get you out. But it does seem like a lot of you are dealing with some of these issues in your body. So if you haven't previously considered it, I would suggest that you speak to somebody like me, maybe even after this presentation, or maybe one of your local physical therapists. For the neck, a lot of times we'll deal with what, like I said, like that wry neck. You could have what's called a cervical radiculopathy. The nerves that exit out of your neck right here can become irritated through injury or just chronic overuse or postural or anything, and you might have some burning, radiating pain down your arm right there. That would be a common one that I treat. The shoulder is extremely common. Usually a rotator cuff tendonitis or tendinopathy would be something that I deal with. The rotator cuff, not the rotator cup, the rotator cuff, is a group of 4 muscles which their primary function is to hold the head of the humerus, your upper arm bone, inside the glenohumeral joint. They also assist in initiating the movements of your shoulder, and if they are affected, then you have to use compensatory movements to get them up like that. So, for example, a really common one would be, Adam, I have pain down the front of my shoulder, or I have pain down the side of my shoulder right here. It hurts when I lift up my arm, so I have to shrug like that. Now I'm getting pain that's radiating up towards my ear, and sometimes down by my shoulder blade. So someone like me is going to go through and do a couple different tests, so without imaging, without use of an MRI or anything like that, ultrasound, we can determine effectively what muscle is affected and how to rehab that. So a real common one would be the scapular retraction, like you just performed right there. We could do things called a glenohumeral external rotation, or I call these why not, like that. Or you could even do a horizontal abduction, like that. So that would be an example of a therapeutic exercise program for a rotator cuff pathology. Low back pain, that's the big one. Who here has dealt with that? You? Come on, I see you back there. I know him, I can joke with him. You know, and it's incredibly common, folks. So a lot of times we deal with back pain and we don't know where it came from. A lot of times people say, where did this come from? How come my back hurts? Why? You know, and I can take a detailed patient history, but the response that I like to give to my patients are, it's the tapestry of your life. It's that thing that happened to you when you were 13. It's the thing that you do every day, all day long. It's your job. It's the job you used to work. All of those things tied together have now resulted in your back pain. Sciatica would be another one on that. If you have hot burning pain going down the back of your leg, maybe you have some pain in between your first and second toes right there. Sciatic nerve comes out of your spine right here, L4 through S3, and it runs through your posterior hip, down your thigh, and then all the way down to the leg. That nerve, it's the biggest nerve in the body. It's about the size of your index finger, actually. It serves the entire leg. It can become irritated through immobility. We're not getting up and down a lot. Decreased muscle mass in your gluteals right there means the nerve is more exposed. So every time you sit down in a hard chair, it's going to hurt right there, right? These chairs aren't hard, right? Okay. Thanks, Norm. And then also the hip. So the hip, a really common one would be like a hip osteoarthritis in there. Osteoarthritis is just an inflammation of the joint. It is not a, I hate to use the word death sentence. It doesn't mean your hip's all the way gone. It doesn't mean you have to have surgery or anything like that. Just showing my patients a couple of stability exercises for the hip and then also for the trunk can decrease the biomechanical load on that hip and then actually make it so that it decreases in pain. It could even abolish all of your pain. Okay? So if you may be thinking, okay, all right, Adam, I've been listening. How do I begin? What do you want me to do? Okay. So you can start just really small, guys, and I would suggest start today. There's no reason not to start today or tomorrow or anything like that. So you can begin slowly. You can have simple exercises first. You want to advance gradually when you feel comfortable. You want to identify your enjoyable activities. That one's interesting because you may remember back, like usually it was around in the 1990s, a lot of people had treadmills, right? And then the treadmill became the thing that you hang your clothes on, yeah. Right? And so I always thought that was so interesting. Like, did you even like running before? Why did you get that? And they go, I don't know, I wanted to get in shape. I was, okay. Just make sure you're identifying what you like first. You know, it could be Pilates, could be yoga, could be walking, could be hiking, could be golfing, any of those things. You want to vary the intensity and you want to avoid overdoing it. Now that being said, like I said earlier, you want to make sure it's kind of challenging, right? If you're kind of just going through the movements, you may not be generating any response. So I would say increase when you can and kind of have that internal grit, like, could I do more? I think I could do more. Maybe I'll try. And just try. You'll never know unless you try. You want to consider somebody like me, a physical therapist, for instruction. And assisted devices can increase your safety. So say you use like a cane, you could use the quad cane, you could use a walker or what's called a rollator walker, those kind of like three-wheeled walkers that can go off-road and everything. I saw a really cool one the other day. A patient brought it in and it was fancy. It was like the Ferrari of these rollators. And she goes, I have a friend and he fishes with it and he takes it out on the beach, his walker. And so he's in water waist high and he's got a walker under there. I thought that was cool. So I really appreciated her bringing that in. Let's see, so resistance and strength training first. That'll lead you to, balance and strength training first. You want to do that so that you're safe, right? So if it's hard for you to stand in one position, you should probably work on standing in one position first. That'd be a good place to start. You want to recruit everybody else's support, so let everyone know what you're doing, you know, so they're not thinking, why is mom like leaving right now? You know, it's like, oh, mom's going on her walk, you know, and they would probably like to join you. You know, as the world kind of starts to open back up right here, you know, and then everybody's kind of getting out into public again, I would say, hey guys, let's go for a walk. And you can be that person that takes everybody for a walk. You can keep it simple. You can walk, you can use household items. I have a patient, it's very interesting. She, I don't know if I want to tell you the other one, but one thing she used was a gourd from her garden, and that was her weight. And so she was using a gourd just like this. I will tell you the other one now. So she used the waistband from her husband's underwear for a resistance band. She put it around her knees and she was doing squats and side steps, and I said, hey, that's great. Good for you. I thought it was very resourceful. Walking indoors is a very common way to improve your physical activity. A lot of times people say, oh, I made it twice around Costco. They'll use that as kind of a reference point for me, and I'm like, oh, I got to get in there and measure. But you could go to like someplace large like a Walmart, one of those big box stores. You want to incorporate it into your daily routine. I tell people this about their exercise, but also their diet. You always want to know what's coming next. So, for example, with the diet, if somebody's trying to improve the way that they eat, I'll ask them, okay, what are you having next? What's your next meal look like? And most of the time somebody would say, well, I hadn't really thought about it, you know. But if you're kind of getting on that consistent pattern, you should know and have it planned when's the next time it is. A really common one, you know, when you go to the dentist and then you're always kind of nervous about the floss question. How, you know, maybe not everybody, but you know that they're going to ask you, right? Okay, how often have you been flossing, right? So my patients, when they come in, they know I'm going to ask about the exercise, right? So they go, I know, I haven't been doing it like that. So on that note, I would always ask them, okay, so when are you going to do it? And they say, okay, well, you know, I'll when I get to it. And I say, well, no, let's think of a day. And so I kind of just push them a little harder. And they go, okay, now I'm thinking about, well, I have time tomorrow after work, so tomorrow 5 p.m. And then I joke with them like, okay, we got a date tomorrow, 5 p.m. And you want to adjust your exercise to your energy level for that day. So if you're feeling kind of, you know, not so peppy, do something, but you know, you can definitely take it, tone it down. And next. So here's a couple just general exercise prescriptions, how to begin. So for aerobic activity, you want to do it at a moderate intensity. You want to do 30 minutes most days of the week. I'd say just go for a walk. Just go for a quick walk. That's probably 2.5 miles an hour around there. You can walk at 2 to 4.5 miles per hour. I've started to see more people kind of coming outdoors, you know, as COVID kind of tones down a little bit, and I would definitely say do that. We are creatures that are meant to walk, not to sit. This is for your resistance training. You'd want to do 2 to 3 times per week. You can choose 8 to 10 exercises. I know that number looks a bit daunting. But you can, I would say, probably choose at least like 5 different exercises. Do 1 to 3 sets, 10 to 15 reps on there, and then focus on the large muscle groups. So I know we've all seen somebody go to the gym, or maybe we've even done it ourselves, and say, well, I'm going to do my arms. Today's an arm day. So that's a small muscle. These are small muscles, guys. So work on your larger muscles if you can, meaning your chest, your back, your core, and your legs. Legs is going to be a big one, especially for back pain. And you know, these muscles are kind of ancillary to the prime movers, the pectoralis and the latissimus back there. So these are going to get a workout if you're using the big muscles too. Interestingly, the body has a lot of, it does a lot of things in order to conserve energy, meaning it takes the path of least resistance. It does the easiest thing. So that's why we might compensate to do a movement. It's not, I should lift my arm like this, not like this. But the proper way to do it actually requires more muscular energy. So you kind of have to get in the habit of, well, it's going to be more tiring, but it's going to be more correct to do that in one way. And let's boogie. So I got one more thing for you guys. These are some exercises that you can do just in the safety of your home. They're real easy. Squats are going to be one of the best ones. For a squat, you would just have your feet shoulder width apart. You have your weight on your heels, not on your toes. Try to push your buns backwards before you go down into a squat. I always tell people it's like if you're sitting on a bench. Yeah, so you wouldn't sit on a bench like this when you squat. You would squat like that. You could do a tandem stance. So if this is your feet, if you stand tandem, that's like when they do the, you know, how much have you had to drink test? The field sobriety test? Field sobriety test, yeah. So tandem stance, you can just stand with your heel to toe, just like that. If you can't achieve tandem, you can have it just to the side, and you're just standing, you're practicing standing. You could go half tandem, like that. And anytime you do a balance activity in your home, if you're just getting started, make sure you have a countertop in front of you and a chair behind you, okay? Another consideration you could do is in the corner. So if you have a corner like this, I'm standing, say I fall, and I would fall into the wall, just like that. Single leg standing is a great one. Interestingly, in the human gait pattern, one leg, it's standing on one leg 60% of the gait pattern as we're walking. 40% of the time it's up in the air. So that's why it's important to have a gait pattern, or excuse me, to have a single leg balance. Same thing, have your back in a corner, or you can do hands on a countertop with a chair behind you. If you're just getting started and you're having a little bit of trouble like moving around, just make sure you have a friend or somebody around you so that you can, until they see that you're okay. You could progress to eyes closed on any of these things. So who here could tell me what body systems are used when we close our eyes? Remember those three that I talked about? Vestibular, and what's the third one? Remember the feet? The feet, yeah, the somatosensory system. Very good, guys, that was good. You got vestibular, that was impressive. So if I close my eyes, I'm actually using my vestibular system and my sensory system as I navigate through space. So that would be a way to up-train those other two body systems. You could even progress to what we call a compliant surface. That would be like a squishy surface. That would be training, that would be kind of like forcing your somatosensory system to be up-trained as well. So what I will ask you folks, this will be the most challenging thing I ask you to do today. If you're willing and able, I would ask all of you to stand up and sit down 5 times. If you don't want to, no problem, but I just want you to feel what it's like to feel using your legs. Everybody ready? Yeah, just keep going 5 times. Try to push your hips forward at the top, squeeze your gluteals, and try to keep your knees behind your toes. Keep the chest up. Very good. Very good. All right, thank you guys so much. Thank you guys for boogieing with me. So that brings me to the end of this presentation. I hope all of you have learned a little bit more about what I have chosen to take my life towards. We actually were selected as a best physical therapist in, I believe it was Monterey County, the Carmel Pine Cone. Carmel Pine Cone? Yeah, thank you so much. This is John Fairman. He's our owner and CEO. He's a wonderful person. If you've ever had the pleasure of meeting him, he is just dynamite. So I hope you have a chance to meet him. So with that, I'd like to thank all of you for having me today, and thank you to the Hoffmans once again. And I'd like to open up for questions. So thank you, folks. Does anyone have any questions? Yes, ma'am.
Physical therapy doesn't involve medication. You're not a medical
Correct. Yeah, so it's outside of our scope of practice to... Oh, sorry. So her question was, do physical therapists prescribe medication? And the answer is no. So we don't prescribe medication, but we are trained in pharmacology of note. I had a semester in my school of pharmacology, and that way I can see like drug-drug interactions. A common one that I see in the clinic is if somebody is on a beta blocker, that decreases the heart rate. So I have to make sure if I'm having them do exercise and your heart rate's supposed to increase, but then you have a beta blocker telling it not to increase, I got to watch out for getting lightheaded or anything like that. Yeah, so I prescribe exercise. Oh, yes, ma'am.
I have 2 questions.
Sure.
Do you need a physician's referral?
Yes, you need a physician's referral. In California, we actually have direct access. So you could see any physical therapist, and you could choose to pay out of pocket if you would like. Usually it's as simple as just letting your doctor know, hey, I heard from this physical therapist, I got this thing, my shoulder hurts, my neck hurts. Do you think PT would be okay for me? And a lot of times the doctor will say, yes, you're taking a vested interest in yourself, and I will definitely take that referral for you.
And my second question is, why is it easier to stand on one foot, this is personal,
Sure.
on the carpeting rather than the wood floor?
Oh, that's a good one. Do you have any pain in the foot?
No, I brush my teeth and I stand on one foot.
Oh, wow.
It's easier to stand on one foot on the carpeting than it is on the wood
That's
floor.
interesting. I honestly could not tell you that. Maybe it's because you kind of sink down in the carpet and it's kind of preventing you from moving around like that. The reason I asked if you had any pain in the foot, sometimes like with hard chairs, people are a little more sensitive down there. But on that note, I'm going to take that from you. I'm going to steal it. I'm going to have somebody stand on one foot and then act like they're brushing their teeth. That's impressive, honestly. Who else has a question? That actually brought up something I also would like to address, the doctor thing. So We're a clinical doctor, not a medical doctor, and it's actually been kind of it's kind of challenging to explain to people. So I did a thesis, and I have my doctorate, and I am known as Dr. Adam Barnard, physical therapist. So because I'm not a medical doctor, I don't prescribe medication, but I do evaluate, diagnose, prognose, and treat my patients. An interesting story, my grandfather, before he passed, he was a car guy, and so he'd meet his friends for coffee every week. So I joined him for coffee, and I was just about to leave to PT school, I believe. And he goes, "Hey guys, this is Adam, this is my grandson, he's gonna be a doctor." And I went, well, you know, like, so yes, we are clinical doctors, but we're not medical doctors, and it's not a PhD, so it's a little bit different from a PhD. So everybody's kind of like, "Well, what do I call you?" And I'm like, "Yeah, you can just call me Adam, Dr. B, I don't know." Yeah. Who else has any burning questions? One more?
Your fit program.
Mm-hmm.
I think that's worth talking about.
Yeah, definitely, thank you. So any patient who has completed a plan of care at Balanced Physical Therapy has access to our facility. So we do it for $40 a month. You can come in anytime that the facility is open, and you can use it as your own personal like treatment center. You can use it as a gym. So a lot of times people will come in and we just say, "Oh, hey, you know, how you doing, Mrs. Jones?" And we just take a temperature real fast, and they say, "Have fun." And they just go on back. You have access to the physical therapists and the rehab aides who are in the facility. You know, you could ask us for tips on like how to do something. So it's not a full-on physical therapy session, but you do have access to the PTs, and you can always, if you like it, we could finish out with like the electrical stimulation and ice or heat, like on your back. And then during your plan of care, so say I see somebody twice per week, I tell them, come in outside of your normal treatment sessions and do the fit plan exercise on your own, and that way you can really get the most out of our time together. And people really appreciate that. Yes, thank you so much. Which clinic were you going to? John Street. I think I recognize you from. Yeah, yeah. So it's good to see you outside of the clinic, right? Like I said. Yeah. He's at the Salinas clinic. Yes, sir.
I'm going to try to ask three quick ones.
Sure.
Any issues for somebody like me in terms of doing sit-ups if they don't hurt?
What do you mean in terms? What do you mean issues?
Well, my mother had a problem with they call it subluxation.
Mm-hmm.
But she didn't do any sit-ups. Don't get me wrong here, but it sounded like maybe sit-ups can contribute to a problem.
Yeah, you know, what you can have is you can have like what's called an anterolisthesis or a retrolisthesis, where one of the vertebrae kind of slides off the front, and then it can lead to like a subluxation. A subluxation would be like when you pop your shoulder out, you subluxed your shoulder kind of thing. So that can also happen to the vertebra. The bad part about it is you got your spinal cord in there, so it can start to butt up against the spinal cord, and you don't want that. So with the full evaluation, we can see if you have more of a what's called a flexion-based program or an extension-based program. So based on the way that the vertebra has moved, you may not want to do this because that might be doing something to the spine that's making it worse. You may want to do the opposite. So that's an important thing to note, that not everybody has the same exercises. So when you go online and you just look something up, like, oh, I'll do that. You know, it's like, well, hold on. You need somebody like me to tell you whether or not. Yeah.
My second one has to do with the vestibular issues. Have you run across cases where people have reoccurrences of the calcium bicarbonate crystals, and they go away and they come back?
Yes. So vertigo, it can go away and come back. What we hope for is that you're treated from the vertigo within probably 2 to 3 treatment sessions, as opposed to like a 12-week program for strengthening for low back pain. This would be a lot more quick like that. I actually couldn't tell you the rate of occurrence, but definitely when I see a vertigo patient, I always tell them, you know, if it ever comes back, you just come on back to me. We can do the same thing.
My third one had to do with some wacky gadget I've seen advertised on the TV. Of course, they're funny.
Yeah.
But this one looked like a guy who was strapped to a gurney, and they flipped him essentially vertical on his head. He's still on the gurney, but are there advantages to doing exercise out of the normal plane of things?
Yeah, so what I think you're talking about is an inversion table. So it'd be like traction. Has anybody done traction in here? Yeah. So traction, the research now states that it's actually not really, what you should be doing, because what traction does is basically you pull on a joint and it kind of opens up that joint space in there. If it's arthritic and it's rubbing up against each other, that's not going to feel good. So somebody like me pulls on your leg or your arm or your spine or something, and that'll free up that joint space. The problem is, as soon as you go back to weight bearing, as soon as you stop pulling on it or you get off the inversion table, that compression returns, right? So by doing strengthening, it's kind of counterintuitive, but because you think muscles pull things together, right? But if you have increased muscle surrounding a joint, it actually increases the joint space. So it'll hold the joint open like that, as opposed to just kind of, rubbing up against each other.
I guess I was interested in anything in whatever vestibular benefits.
Yeah, definitely. I think I have. Usually we don't see vestibular patients for a long time. Usually we'll treat the vertigo, and that would be like a 2, 3, 4 session thing. And as soon as everything's good to go, then we may move into like a balance and mobility referral from your physician. And if it's due to like a hypomobile neck, if you got like a neck strain or something like that, we may just change the referral into a cervical referral. But yeah, come see us. Okay. Anything else? Okay.
You're going to be around a little while, so if you want to ask Adam a question personally, you can. He'll be back in the back.
Sure.
They've filmed all of you, so you're going to be in the movie now. All right?
Great. Thank you
sir.
so much.
Appreciate it.
Thank you so much, Norm. Great. Thank you, guys. Thank you.